Democratic Visions is handmade in Eden Prairie and Minnetonka by DFL Senate District 42.
The citizens of Minnetonka and Eden Prairie recognized that Representative Maria Ruud performed superbly as a legislature, not only representing their interests, but the interests of the state in general. What I'd like to talk about, Maria, is some of the issues of the day, starting off with health care. Now, I know you're a nurse practitioner. Do you have some observations you could share with us as to what you believe the problem that has to be addressed out there is, and how Congress is going about taking it on?
I think it's been confusing for the public, maybe a little bit frustrating. I do see glimmers of change that I think will be good. One of the things that passed in the House bill had to do with pre-existing conditions. If you are somebody who has, for example, you've had a heart attack, and you lose your job, and then you need to apply for insurance, because when you change jobs, you maybe lost your insurance that went with that job. You have to fill out a form, and the insurance companies can look at that and say, you know, you're kind of a high risk. Looks like you've had some heart issues, and we are going to decline you in giving you the insurance.
The insurers can turn you down with impunity? Yes,
that's right. And so I think if we got rid of that, I think, to me, that has the potential to change the whole debate. And why that is if the insurance companies now have to cover everything, I believe that they're going to cover everybody. That they have to, you know, if people apply, that means they, you know, everybody has to be given the insurance. They can't turn them down for a pre-existing condition. I think they're going to take a second look at all the policies that we have in place that either contribute or deflect from people's ability to be healthy.
Like what policies might that be?
Well, I think you look at some of maybe our agricultural policies, some of the things that we have in place. What do we have in place that potentially is contributing to obesity? Do we have policies that help our communities and our citizens lead healthy lifestyles? Because they're going to want people to be healthy. What
is your sense of how the Republicans and the Democrats view legislation addressing the pre-existing condition situation?
You know, it passed, so I think that's good.
Well, it passed with one Republican vote.
Yeah, yeah. You know, I have to tell you, I think if they were really listening to the public, they would hear that that's a pretty big issue, and I think they would climb on board with that, because I think that is something that a lot of people bump up against, and I can tell you when I have been door knocking in my district, I hear about that the most.
Do you think that the bill has to include a public option?
I don't know that it has to. I think it would provide some competition for the insurance companies and hopefully make everybody and everybody's plan a little bit better.
Well, is there any other aspect of the healthcare debate that you think is particularly significant to Minnesotans at the present time? I
think, you know, the pre-existing conditions, getting rid of that, and then the talk of the mandate that everybody has to have insurance. Yeah. Good and bad about that. I think some people don't see the value in purchasing.
Has that surfaced in this state, the idea of mandate?
It has been kicked around a little bit, and I've actually heard about that when I've been door knocking and talking with people. Some people really choose not to carry insurance because they do not see the value in it, and their dollars are so limited that they're willing to roll the dice.
I see.
Again, I think the insurance companies would tell you that if we're going to exclude pre-existing conditions, everybody has to have it. Everybody has to be in.
Sure.
So it's a trade-off, as always.
Well, let's do a little bit of a sea change here. Now, I know that there's a big project that's about to be underway out in the Minnetonka area at the intersection of 169 and Bren Road.
Right. That particular area, that interchange, why they want to change that area has to do with United Healthcare. We have the situation in Minnesota where we have some businesses and the growth of the business being stifled because of what's happening with our transportation systems. So it's actually impacting the economic development in an area. That is very concerning. And United Healthcare is a very big employer in our district. They provide a lot of good paying jobs for the people in this area, and they would like to expand, but it's really difficult with how the situation is right now with the interchange. Too much traffic flow for that area. I did have legislation that would have addressed that. It had to do with the area and businesses being taxed for that. Okay. It was a different approach. It was very controversial, and I knew it was controversial going forward. But it was a way for us to get the discussion. So we had the debate.
It was great to work with and watch Maria work on this project. She supported it early on, saw the difficulties with the original taxing districts in there, and helped and worked with us as we came up with these new funding and financing packages. We looked at the entire Opus area, evaluated who's going to get additional parking, who's going to use that parking, and say, let's just share it up. Who is coming in, and as you grow, you pay for getting that additional traffic capability through that intersection. And the reason I think they really like this, and it's a great kind of project, is the businesses will pick up half the cost of this in the long term. So it's a share, the business get to grow, and they get covered part of the funding of it. It works out great for everyone. United Healthcare alone is going to create about 1,400 jobs. But more importantly, the whole Opus complex will be able to grow about 3 times that many jobs over the next 10, 20 years as this additional traffic is available.
You know, creative solution.
But the other thing, I suppose, is that you're going to have a lot of construction jobs out there, are you
Right,
not?
that's right.
Which is another advantage.
That's right.
That's great.
Now, before we go, here's a good idea. Come to one of our DFL community forums. Why? Well, you're going to be with Minnesota's top progressive leaders and thinkers, trading thoughts on the big issues. Now, these forums aren't debates, they're conversations, and you're at the table in a local cafe, coffee house, or library. Get on the web right now and go to http://myaurora.org. That's http://myaurora.org for topics, guests, times, and places. Thanks.